Hey, I'm going to take a few minutes to dispel common myths that I see in wound care, especially for clients after they've had plastic or cosmetic procedures. So, these are just some things that you can take into consideration. Maybe you're under the same belief and your wound's not getting better, and you can use these tips to improve your situation. I'm Dr. Heather Flexer. I'm a doctor of physical therapy and a certified wound specialist. You can find me at betterwounds.com or wherever you're seeing this video. But one of the big ones is wounds needing air. I'll hear all the time, like, oh, sometimes I wear a dressing, sometimes I feel like it needs to get some air and dry out. That is fine for an incision when it's closed. So as long as there's like very little or no drainage, um, the edges are all nice and sealed, you're going to leave it dry and open to air. That's perfectly fine. Maybe you're going to put like a dry dressing over it just to protect it so there's not friction and rubbing. And that is 100% fine for closed incisions. When your wound is open, there's a hole in the skin that's a break in the protective layer of your skin, and now you're susceptible to infection, and so the wounds should be covered. It's also been proven that wounds heal faster with a cover dressing over it. So that's why moisture balance is key. So I think a lot of the times why people talk about covering their wound is because it gets goopy underneath just the bandage, or they're putting a lot of ointment on it and then they're covering it with a bandage and they're like, ew, it looks gross. Well, you're probably not using the right thing. And so there are a whole host of wound care supplies, wound dressings, and things like that that can be utilized, and you're probably just not exactly using the right one. So that's what the moisture balance is about. You might need a dressing that's more absorptive. So, like we talked about, if there's drainage, there's better dressings than just gauze, and that's better than air. So, there are thousands of wound care products out there. If you don't know what to do, that's a good time to reach out. If your doctor's just telling you to use gauze and that it's going to take time, that's another time to reach out. I work with tons of people that are also working with their doctors. So here's another myth. Compression is bad for wounds. Now, it's not totally wrong. Too much compression can be awful because it's limiting circulation. A lot of times when we don't know how bad the wound is yet, or while it's still evolving, that's when maybe we don't want too much compression. So, if we're not sure if we have a lipo burn, or is it a lipo burn or a faja burn? Those are times when compression can really be a detriment, when we have a lack of blood flow to begin with, and we don't want something super, super tight. Compression is a good thing, though, for wound healing because it does prevent excessive swelling. So if you're noticing swelling in the lower legs, or your ankles are really swollen, maybe you don't want to wear the compression right on a big giant open dehisced tummy tuck wound because it's not feeling good. You may need the compression on your lower legs to provide adequate venous return, to get all the swelling out of your legs. There's lots of ways that compression can be beneficial. It provides support. It may help limit pain a little bit when you're moving around and trying to do things, and having an open wound and going about doing the things that you need to do for life. You may find that extra support feels good. So it's something that needs a little fine tuning as well. Working with a lymphedema specialist, something like that may be useful. Again, you can reach out. I know plenty of people that are very good at this. One way to tell if your compression is too tight is if the wound that you have starts looking darker, looks grayish, looks worse. I've had folks that have had they've been packing the wound and then wearing compression, and what's happening is they're limiting blood flow because they were overpacking the wound and then putting compression on. So the wound actually looked a little bit pale and grayish. So you're monitoring how what you do affects what the wound looks like. So you do want to take a look at it. Pictures are sometimes helpful because you can discern a little bit better. Maybe you can get a better look at what you're looking at through a picture. So take pictures. It doesn't hurt, even if it's just for you. I know when I work with folks, I ask them to send me pictures. So that is a good thing to do. But compression is not always a bad thing. But some compression that's too tight and limiting circulation definitely is a bad thing. Next one, wounds can take months to heal. Well, that is very dependent on how big, how deep, and how bad it is. So there are a lot of factors in wound healing, and there are things that you can do to speed it up. So advanced dressings can help speed that timeline along. Advanced dressings is not Hib cleanse and gauze. I can tell you that for sure. If you have debridement of the dead tissue, that is going to help. If that's not something your doc feels comfortable doing, then I would recommend you find a wound center near you. Just Google wound center near me and give them a call. Not all of them require a referral, so the least you could do is give them a call. But absolutely having the dead tissue removed is going to speed that timeline of healing. And you must fuel your body with food. So if you're not giving your body the necessary nutrients in order to grow new tissue, right? Like we hear it all the time. I'm not really hungry. It doesn't taste good. I don't want it. That's all well and good, but we've got to find something that you can tolerate. You need fluid, you need protein, you need nutrients, you need all these building blocks of tissue in order to grow new tissue. So you absolutely need to eat, need to drink, need to move in order to get your wound to heal as fast as possible. And working with a wound specialist can absolutely help you, speed that timeline along. Your surgeon will heal it. So not all surgeons know wound care. A lot of them do. Some wounds are like pretty minor, and using basic wound care will heal it and it will be fine. But if you have a very deep wound, there's a lot of necrotic tissue, things aren't really speeding up, you're just hearing the same thing, like it's going to take months, use the gauze, use the saline, blah, 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 then it's time to find a wound specialist near you. That's going to help speed things along. I've had clients that have said, their surgeons got pretty upset with them for asking too many questions or getting upset. Whatever, it's your body. You've got to do what you got to do. So what you do between your appointments is going to make a huge difference. So working with specialists, eating the right nutrients, getting moving again, all of these things are going to help your body heal. Your body is really the thing that's going to heal the wound. So finding people that are going to help support you is your best bet. If you're, having signs and symptoms of septic infection, like you really don't feel good, you're not moving well, you're not eating well, you have a lot of pain, you have a lot of drainage, the wound's getting worse, you may want to go to urgent care, ER. You just have to, figure out what's going on. But those are things that have happened before, so it's something for you to, be aware of. Your surgeon absolutely has the best intentions for you. They want their work to look good. They want you to feel good. They want you to be like an example of their work. So this isn't what they want. They're not necessarily telling you that, the wrong thing because they are trying to be malicious towards you. They just maybe don't know wound care. So you need to take matters into your own hands sometimes. So hopefully this is useful information to you. You can share this info if you find it useful. You can reach out if you need personal advice. Again, I am a wound care specialist. You can find me at betterwounds.com or wherever you found this video or this clip. But go ahead and reach out. I hope you're doing well. I hope none of this applies to you. But if you do and you need support, I'm here. Hope you're good.